Hello, my name is Tanya Frainer. My pronouns are she, her, aya, and I am the Regional Council Manager for Birth to 5 Illinois, Region 21, covering Franklin, Johnson, Massac, and Williamson Counties. Thank you for watching Region 21's Early Childhood Regional Needs Assessment Virtual Report. This recorded session will provide an overview of findings from the Birth to 5 Illinois Region 21 Needs Assessment, as well as talk about the strengths, needs, and recommendations for improving access and enrollment in early childhood education and care programs in the region. A link to the full report can be found in the description below. If you would like to turn on closed captioning, click the CC icon at the bottom of the video. This will turn on the captions. If you want a language different than English, click on the gear icon for settings, click on subtitles, then auto translate, and you can scroll down to pick the language you want. In 2021, the Illinois Commission on Equitable Early Childhood Education and Care Funding issued a report with findings that highlighted the inequities in early childhood funding in Illinois and the need to create a better statewide infrastructure to support early childhood professionals, expand services and programs for families and caregivers, and increase enrollment in ECEC programs. The report focused on the importance of addressing racial inequities and the need to include local voices in the conversation funders and decision makers were having about early childhood education and care. To provide a structure for communities, families, and caregivers to engage with the data and share their experiences, a new statewide infrastructure was created across 39 regions, all of which align with existing Illinois State Board of Education regional offices of education boundaries, but operate independently. Birth to 5 Illinois regional boundaries align with school districts instead of strictly following county lines, which can be a challenge for gathering and interpreting data because many early childhood services are provided by or tied to school districts. Region 21 is beautifully located in the rural southern hills of deep southern Illinois, spanning 1,466 miles. It borders Kentucky and includes Franklin, Johnson, Massac, and Williamson counties, and is the home to Superman and some of his closest allies and foes. It is a traditional home to the Osage, Miami, Kickapoo, and Sioux nations. It is a rural area with many small towns and villages filling the landscape. The region's big industries include 4 state and federal prisons, Pepsi-Cola Bottling Company, Ison Manufacturing, local community colleges, and agriculture is a mainstay. Region 21 is also a coal impact region. Joining me in the Region 21 office is Chelsea Dials, our Family and Community Engagement Specialist, and our administrative support, Rebecca Holcomb. Now over to you, Chelsea.
The experiences and knowledge families, caregivers, and early childhood professionals gain while navigating the complexities of the state's early childhood education and care system are valuable, and understanding their lived experience in local context is vital for decision makers to ensure communities have access to the programs, services, and supports they need. To this end, Birth to 5 Illinois was created to harness family and caregiver voices in early childhood education and care and serve as a bridge between the communities and policymakers, so family, caregiver, and professional experiences can guide the decisions made to expand or enhance services across the state. Our mission is to create a statewide regional infrastructure that will amplify input from communities in the development of policies and funding priorities. We support the mobilization of communities to build and sustain equitable access to inclusive, high-quality early childhood services for all children and families in the state of Illinois. We envision that our work will help all stakeholders reimagine a more equitable early childhood education and care system that respects family and community voice and works to ensure it is centered and prioritized at every level of decision-making in Illinois. We have 3 main values and goals. First, we must prioritize family voice. Through this transformation centered on authentic family and community engagement, we will address the inequitable distribution of resources and services and rebuild our state's early childhood education and care system. Second, we must address the racial inequities that exist in our early childhood system. In an effort to move our early childhood education and care system to one where racism no longer impacts a child's success, we will work to dismantle barriers that have limited access to high-quality services for minoritized children in every corner of our state. Third, we will use the collective impact model to shift the current early childhood system to influence policy and funding at the local, regional, and state level. Birth to 5 Illinois will use community-driven feedback to build a system that harnesses knowledge directly from the families and providers and encourages decision makers to ensure new and/or expanded services are created to meet community needs. Two critical parts of the new statewide infrastructure are family councils and action councils. Located in each of the 39 regions, the councils provide feedback on quantitative data from the Illinois Early Childhood Asset Map, or ICAM, and the Illinois Network of Childcare Resource and Referral Agencies, or INCRA, to help contextualize the data at the local level. The councils meet twice a month in virtual, in-person, or hybrid meetings. The family councils are comprised of parents and caregivers from a wide variety of family types: single parents, adoptive and foster parents, caregivers of relatives, teen parents, two-parent families, multi-generational families, and more, and prioritize the voices of those who have not been involved in this type of work before. We want to highlight those who have been involved in our Region 21 Family Council over the past year and thank them for sharing their experiences with the early childhood system. Rose Arview, Karen Beach, Lindsay Bridgewater, Stephanie Cottle, Amy Kokoyo, Emily Crow, Amber Elledge, Serena Goff, Mitch McClellan, Emily McFerrin, Meredith Rubel, Ashley Scott, and Beth Ward. And now back to Tanya Frainer.
Action councils are comprised of early childhood education and care professionals, healthcare providers, faith leaders, elected officials, and other community members. Each action council reserved 2 seats for parents, caregivers to ensure family voices were included in every discussion. Action council members were invited to bring additional aggregated data on programs and services provided by their agency organization to complement data from ICAM and INCRA. We extend thanks and gratitude to our Region 21 Action Council members: Missy Brown, Lee Eklund, Barbara Green, Terrence Henry, Philip Halsfelt, Patsy Jensen, Kathy Keel, Candace Lewis, Edrica McDowell, Jennifer Parks, Jamie Reagan, Jonna Schulian, Pam Thrash, and Barbara B.J. Timmons. Now over to you, Rebecca.
Beyond the council meetings, additional qualitative data was collected community-wide through focus groups and interviews, and all council members were invited to provide input on each section of their early childhood regional needs assessment. We received feedback from over 1,000 people in Region 21 via focus groups, interviews, surveys, and community conversations. Council members developed the strengths, needs, and recommended next steps that are unique to each region. Regional teams, along with the support of their Action and Family Council members, created a dissemination plan and are holding community meetings virtually and in person to share their reports' findings. The following slides highlight some data that was discussed by council members and provide insights into the early childhood education and care landscape in our region. 92% of the population of Region 21 is white. Data shows that 29% of the 0 to 5 population is representative of minoritized populations. The largest of those, 348, are children identified of 2 or more races. In addition to racial inequity, geographic inequity is a reality in this rural region. The average commute to work time is 24 minutes, and those children who live in one of the 27 rural villages or unincorporated areas have limited access to resources and are forced to commute to one of the larger towns to find childcare programs and services. Part of the conversation with council members were around priority populations, defined by the Illinois Early Learning Council as groups that have been historically underserved by early childhood education and care programs. In Region 21, the priority populations include children living in families in poverty or deep poverty, children living in single-parent households, children in foster care, children with welfare involvement, children or parents/guardians with disabilities, children being raised by a relative. While data on children and families from priority populations is limited, there are a few things of note about Region 21. According to ICAM data, 47% of children ages birth to 5 are living in households with incomes at 200% federal poverty level or less, meaning that many of them were eligible for a number of state-funded early childhood programs. 55% of these children live in households with incomes at or below the 100% federal poverty level. Income threshold for 100% federal poverty level is $26,200 per year for a family of 4. In addition to the priority populations that we have listed, an often overlooked population in our region are the families that work and make just enough money to fall above the eligibility income requirements for assistance. Additional information about priority populations was gathered through surveys, interviews, and focus groups, and is included throughout our final Early Childhood Regional Needs Assessment report. I will hand it off to Action Council member and CCR&R Director, Missy Brown.
Community collaborations are an integral part of the early childhood landscape. Local early childhood community collaborations bring together community agencies, organizations, and individuals with a shared vision or goal. They understand the importance of improving early childhood education and care for children, caregivers, and providers. Region 21's local early childhood collaboration, the Southern Illinois Coalition for Children and Families, is Region 21's only formal community system collaboration. It covers all 4 counties in the region, plus an additional 11 counties outside the region. In addition to this formal collaboration, the Johnson County Cabinet for Children and Youth is an emerging collaboration, and it covers Johnson County. The Southern Illinois Coalition for Children and Families has been working to provide leadership and support to build strong communities, strengthen families, and promote children's success in school and life. The coalition has 5 strategic priorities identified through comprehensive stakeholder input: school readiness, screening, workforce, strong families, and acting as an impact accelerator for local collaborations and other initiatives that engage community members in championing the issues important to their mission. Current coalition strategic priorities include developmental and social emotional screening, the early childhood workforce, strong families, communication, and building caring and engaged communities, acting as an impact accelerator for aligned systems work, such as Birth to 5 Illinois and the Johnson County Cabinet for Children and Youth. Recognizing that some of the work is more effective when implemented at local levels, the coalition worked in partnership with Resilient Southern Illinois and Harvard University to launch this new Children's Cabinet in the fall of 2022. As an emerging collaboration, the Johnson County Cabinet for Children and Youth will work in partnership with the coalition to address needs specific to Johnson County. The Johnson County Cabinet for Children and Youth is a community-wide collect impact emerging collaboration to help children and families reach their fullest potential. Their mission is to ensure all children and youth from cradle to career living in Johnson County will have access to the programs and services and their families need to grow and thrive. The Southernmost Illinois Early Learning Special Education Collaborative serves Johnson, Massac counties, along with Alexander and Pulaski counties, which are in Region 30. This emerging collaboration received the Birth to 5 Planning Grant, which is being used to increase collaboration among various schools, agencies, and individual providers serving young children in our area. They are working collaboratively to complete a self-assessment and identify training needs of staff and service providers. This tiered approach to systems work is efficient in terms of resource allocation, avoiding duplication of effort and alignment of missions. More information on this local collaboration and emerging collaborations and the work they're doing can be found in the Regional Needs Assessment. Although overall there is not enough care, there are a variety of early childhood education and care options for parents and caregivers to choose from throughout the region, including childcare, family childcare, preschool for all, Head Start, Prevention Initiative, Early Head Start, Healthy Families Home Visiting, Early Intervention, Early Childhood Special Education, and Family Friend and Neighbor Care. But access to early childhood programs and services is not equitable for all the region's families. The biggest need throughout Region 21 is birth to 3 services. 3 out of 4 children in Region 21 do not have access. A parent in Johnson County noted, "In my county and in my personal experience, there are only 38 slots for children ages birth to 3 in my county. I cannot even fathom the fiscal and emotional stress of having to try to raise a child in Johnson County if family was not an option." When options for childcare arrangements are limited or inaccessible, it impacts parents and caregivers' ability to participate in the workforce. Families and caregivers reported that they were highly reliant on grandparents or other family members to provide childcare for their children so that they can work or seek employment. There is a program that families can apply through the Illinois Department of Human Services, or IDHS, called the Child Care Assistance Program, or CCAP. This program provides families with limited access to financial resources and access to quality, affordable child care while allowing caregivers to continue working and or completing their education. One parent stated, "I have my 3 kids in daycare and CCAP has helped a working mom stay working." All families are required to cost share on a sliding scale based on family size and income. According to data, many families who may be eligible for CCAP do not participate in the program. Among the barriers are lack of knowledge regarding how the program works and a lengthy and difficult application process. Region 21 has a variety of publicly funded options available, such as Early Head Start, Preschool for All. However, not all programs are full day, nor do all programs provide transportation to and from the program, leaving many families who qualify for publicly funded preschool choosing not to enroll them in the program. Additionally, there are not enough spots and very limited non-traditional hour care for families to enroll their child in care across the programs in the region, leaving some families with very limited options for child care. At this time, I will pass it over to Amy Kokuyo, Family Council Member for Region 21.
Through various community meetings and conversations, focus groups, interviews, and surveys, feedback from families in Region 21 reiterate the urgent need for affordable child care. Working families need more access to full-day state-funded programs with providers and teachers that are well paid, supported, and who can provide quality care and sustainability for our children. Similar to other areas of the state, Region 21 is experiencing a staff and teacher shortage throughout the entire region, preventing programs from operating at full capacity or expanding to meet community needs. According to the Illinois Salary and Staffing Survey of Licensed Child Care Facilities, fiscal year 2021, the median annual wage in child care occupations in Region 21 is $26,018. While individuals serving in administrative capacities in child care centers are most likely to receive wages above the region's median wage. The majority of child care center teachers and assistant teachers are earning well below the median wage for employed persons in their county. Family child care providers and school-age assistants earn the least in our region. One parent noted, "I took a huge pay cut when I left my job at Texas Roadhouse for my child care job. I am just now, 3 years later, making what I made leaving Roadhouse." 52% of the children under the age of 6 live in Williamson County. In more rural areas of the region, parents and family members are driving an hour round-trip commute to get their children to childcare so that they can go to work. Childcare providers indicated that when they can hire new staff, they often lose them quickly to other jobs. They are finding better pay and benefits elsewhere. Early childhood administrators in the region noted that they are seeing a large percentage of their educators discouraged by rapidly declining support and regard for the hard work that they do. They're facing more requirements, less time to accomplish them, and experiencing an increase in child behavior issues in their classroom. Because of the workforce shortage, Region 21 has limited options for families in regard to early childhood education.
Thank you, Amy. Over the past 10 months, we have had direct interactions with parents, families, and caregivers in Region 21. This needs assessment is a direct reflection of parent, family, and caregiver voices and lived experiences. Almost half of the children in Region 21 are living at the 200% or less federal poverty rate. These children are living in families with limited access to resources. Parental feedback indicated needs for food, basic resources such as medical and dental care, and funds to support the rising cost of rent and utilities. This, coupled with a rural spread out regional landscape, provides unique challenges for parents, caregivers when accessing care. This results in parents having to commute further to access care or choosing not to access ECEC programs by not entering the workforce. Personally, I drive my daughter 27 miles from home to attend preschool. My office is now right down the road from my house, but I did not want to pull her from where she was in fear that she would not get a spot in our hometown due to the limited availability and the long wait list. It takes me an hour to get her to school, walk her to her classroom, and then get to work. It puts a strain on us in the mornings to rush around for me to get to work on time. Family, friend, and neighbor care is a viable option in Region 21, especially for those working non-traditional hours and or living in very small communities where more formalized options are not available. Currently, there are 143 families using this care. Another parent shared their lived experience. "I recently became a single mom, head of household, and the only wage earner. I must work to feed my children. I need reliable, affordable childcare. When I recently chose care for my youngest child, I took a spot because it came available. I did not choose a center because of references, quality, a good review, transportation, cleanliness, etc., because I did not have that option. I desperately needed childcare so that I could go to work." Community and council members identified several strengths and needs of the early childhood system in the region. For the sake of time, I will only share a few. I will start with the strengths. The greatest strength in our region is the people and their relationships with one another. We are committed to building a regional infrastructure and desire to collaborate and share resources to meet the needs of children and families in early learning. The leadership of experienced ECEC administrators in this region has helped move programs and initiatives forward, even during the pandemic, which helped mitigate the negative effects of staff turnover and the workforce shortage. Although overall there is not enough care, there are a variety of ECEC options for parents, caregivers to choose from throughout the region. The Southern Illinois Coalition for Children and Families, SIFCC, has developed a strong and effective infrastructure that helps connect and coordinate services, maximizing the region's current resources and promoting better child outcomes and strong family support. This group provides leadership and support to other collective impact initiatives, addressing issues that are best addressed at the local level by helping lay a solid foundation for this work. The Johnson County Cabinet for Children and Youth, JCCCY, is a community-wide collective impact emerging collaboration, helping children and their families reach their fullest potential. The large number of state-funded pre-K and prevention initiative programs in the school districts demonstrates the understanding superintendents have about the importance of early childhood services and their role in school readiness. Head Start, early Head Start programs are in the communities with the highest areas of poverty. At this time, I will make a quick transition over to some key needs of Region 21. Families need more information about the Child Care Assistance Program, CCAP, including family and provider eligibility. Families need access to more birth to 3 services. Early childhood educators need wages equal to other teaching counterparts along with benefits. You can find the complete list of strengths and needs in the Regional Needs Assessment. Based on community and council conversations, recommendations have been made on how early childhood education and care programs and services can be improved for families in the region. Recommendations will be presented to lawmakers, state agencies, local elected officials, and funders so they can better understand the needs of families in the region and share the recommendations with them so they can see how to best meet those needs. These are a few of the recommendations made, but more can be found in the Regional Needs Assessment. Recommendation 1. Increase the utilization of the CCAP by increasing promotion and education for families. Recommendation 2. Expand birth to 3 services in the entire region. No county in the region serves more than 29% of its children. Recommendation 3. Share information about the state's current workforce initiatives. Educate the public about the need for more teachers and advocate for increased public dollars that support adequate compensation. I am passing it back to Amy Kokoyo, Family Council Member.
This summer, we will be out in the community talking to more families, providers, and stakeholders about their experiences with early childhood education and care, and we want to talk with you. We invite community members, families, and early childhood professionals to join the conversation by filling out a council interest form. For me, being a member of the Family Council has been a wonderful experience. I am excited to be a part of the positive changes in our community. Please go to www.birth5il.com/councils or click in the link in the description to get involved. Interest forms will close later this summer, with council meetings fully resuming in August. I will send it over to Tanya for the closing slide.
I want to thank our state partners for their support and you for watching. We encourage you to stay in touch with us by visiting our regional webpage at www.birth25il.com/region21, joining our Facebook group, or reaching out to me via email at tfrainer@birth25il.com. Links to our pages, along with my email address, are available in the description below. Thank you for your time. We look forward to connecting with you soon.